Now, so far, I've talked about 5 different types of memory. But a reasonable question would be, why should we classify memory phenomena into these categories? Maybe there could be other ones that are just as valid, especially since in practice, any actual cognitive task is likely to involve different activities that resemble all the types. The reason for picking these 5 are based on some criteria proposed a number of years ago by 2 scientists called Tulving and Schachter. They suggested that a memory system in the brain could be regarded as independent if, firstly, you could identify a lot of tasks that appeared similar but used different information, like all the category determinations in semantic memory for different categories and examples, or all the episodic memory recalls for different events. Secondly, if you could write down a list of features for the memory type that were different from the features for any other memory type, that type could be regarded as a different system. And that's essentially what we've been doing in the earlier sections. And thirdly, and very important, if you could make a change to the environment within which memory retrievals occur that affected one type of memory and not the other, or produced different effects in 2 types, then the 2 types could be regarded as different memory systems. And a common example of this third criterion is if brain damage affects one type of memory and not the other. So with this in mind, let's have a look at the effects of some different types of brain damage on the different types of memory. Korsakoff syndrome results from lack of the vitamin thiamine in the diet, which is often the result of long-term alcoholism, with a high proportion of calorie intake coming in the form of alcohol. The most obvious effect in the brain of thiamine deficiency is damage to a structure called the mammillary bodies in the hypothalamus, although damage to other regions, including the hippocampus, can sometimes be detected. If you were to visit a patient with severe Korsakoff syndrome, the patient would appear to be able to carry out a normal, intelligent conversation. However, because all episodic memories from the present back for a long period in the past have been lost, the patient believes himself to be the age at which he has the most recent memories, which could be 25 years younger. And furthermore, his inability to acquire new episodic memories means that if you leave and return again 15 minutes later, he'll have no memory of ever having met you. He's also unable to learn new words or facts. But as demonstrated by his conversation, semantic memories of words and other facts acquired before his illness and his working memory are all intact. He retains skills learned prior to developing the syndrome and can learn new simple skills that don't require any decorative memory. And experiments demonstrate that his priming memory is intact as well. In other words, the different memory systems are affected differently. New semantic and episodic memories can't be acquired, but all semantic and episodic memories acquired before he developed the illness are intact. In contrast, learning some simple new procedural skills is still possible, and priming and working memory are completely unaffected. In the early 1950s, a number of patients suffering from severe epilepsy were treated by removing large parts of their hippocampal system. And this experimental treatment was successful in treating the epilepsy, but was discontinued when it became apparent that side effects, including severe memory deficits, occurred. One of the patients was Henry Molaison, or HM, and the nature of his deficits was extensively investigated until his death some 50 years later. His combination of deficits strongly resembled those exhibited by Korsakoff's patients, with the addition that he wasn't able to access episodic memories for the decade preceding his surgery, although in contrast, any words learned during that same period were still remembered. So in this case, there was a difference between the ways in which the episodic and semantic memory systems were affected by the damage. The cortex can be damaged by strokes, by infections, or by blows to the head, And if the damage is to the inferior temporal part of the cortex, it can affect past semantic memories without effect on episodic memories. For example, in one case, the patient could draw inanimate objects, but when asked to draw a specific animal, could only create a generic sketch that looked the same for all animals. Another patient couldn't provide verbal definitions of words like needle, goose, or acorn, but could provide definitions for abstract words like supplication or satirical. Yet another patient, hearing a word like rhinoceros, responded, "It's an animal, can't give you any functions," but shown a picture of a rhinoceros, could respond, "Enormous, weighs over a ton, lives in Africa." However, objects like lighthouse and wheelbarrow could be described in response to words. This patient could say lion in response to king of the jungle, but couldn't provide the word zebra in response to black and white striped horse. And then again, in this case, words for inanimate objects were not affected. And all these patients could still recall autobiographical memories. In a particularly striking case, the patient lost extensive amounts of semantic memory, including many meanings of common words, names of famous people, historical events, geography, social customs, attributes of animate and inanimate objects. However, the memories of many incidents in her past remained, including her engagement, honeymoon, her children's births, and her father's death. In Parkinson's disease, neurons die off in a part of the brain called the substantia nigra, and this disease results in loss of ability to initiate movements. And in its early stages, although there's no measurable loss of old or new declarative memories or of working or primary memory, the ability to learn new skills deteriorates. Priming deficits rarely result from brain damage of any kind, but in the case of Alzheimer's disease, there is a deficit. This kind of deficit can be observed, along with major declarative memory deficits. But on the other hand, the ability to learn simple new skills is still preserved. In patients with declarative memory deficits, working memory generally operates normally. In working memory test of retention of long lists, the recency effect remains, although the primacy effect disappears, confirming that primacy is in fact a semantic memory phenomenon. Now, deficits in working memory are rare, but a few have been reported, like the patient KF. In this patient, verbal recall for single numbers or letters or words presented verbally was good, but deteriorated considerably for two-item lists. Recall of visually presented items was less effective, indicating the use of different brain resources. Declarative memory, in this case, didn't appear to be degraded. So in summary, brain damage to different regions leads to deficits in different memory systems, indicating that these are indeed the appropriate classifications for memory for understanding in terms of brain anatomy. Now, there's one other type of memory that's sometimes referred to as the ability to remember the future. It's the way we label the ability to remember to go to appointments, to pay bills on time, and so on. And it's critically important in everyday life. Now, failures of prospective memory can occur in almost everyone, but they tend to become more frequent as we age. They become very common as Alzheimer's disease progresses, and obviously they have a severe impact on the ability to function socially. Now, although prospective memory has a separate name, it probably operates by a combination of the other memory types, which is why it's one of the first memory deficits to manifest itself in dementias, because a deterioration in any of the primary memory systems can lead to prospective memory failures. Now, at the end of this section, I'm going to mention sleep, because whatever other roles sleep may play, and there have been lots of ideas, including enforcing a period of rest, forcing us to stay out of danger during darkness, cleaning out waste chemicals and so forth, it does seem to play a role in both declarative and procedural memory. Now, as I mentioned earlier, sleep is not a passive rest state for the brain. There are strong patterns of electrical activity that are quite different from waking activity. During sleep, this electrical activity goes through a 90-minute cycle of stages that repeats a number of times during the night. REM sleep contains strong dreaming, and the proportion of REM sleep increases later in the night. And during sleep, there appears to be a partial replay of brain activity during recent waking behaviors. When animals or people are deprived of sleep, both declarative and procedural memory appear to be affected, but pinning down the precise effects has proved to be very difficult.